will be here in the studio, and then we're going to have that conversation. But before we delve properly into all of that, this morning I've been joined here by the president of the Rotary Club Accra East and a health practitioner as well. They are organizing something for, the month of October is globally designated to breast and breast cancer related issues. And so if you've been following the show, we've been having guests in that regard. And this morning is no exception at all. And so Mr. Mumuni Haruna is seated here. He is the president of the Rotary Club Accra East. And Madam Rita Odonko is a senior health tutor at the Public Health Nurses Training School. Good morning.
Good morning.
Right, welcome to TV Africa.
Thank you.
Right, let me start with you first of all, Mr. President. What is inspiring this very initiative in the very first place? Why are you deciding to embark on the awareness and screening project?
Thank you very much. Let me take this opportunity first to thank TV Africa for giving us this opportunity.
Right.
This is the second year in running that you have decided to partner with us for us to reach out to the Ghanaian community. I want to take this opportunity also to tell viewers about Rotary. Rotary is a network of over 1.2 million professionals across the globe. Basically, we come together, identify problems, and we are problem solvers. So reason why we decided to focus on breast cancer, especially for this month, we all know that the month of October is Pink Month.
Right.
And then in Rotary, we have 7 areas of focus. So one of our areas of focus is prevention and treatment of disease. And this falls under that. So every Rotary year, which is a calendar year, starts from 1st July to 30th June, basically the incoming president and his board would outline projects that they want to do. So for this particular Rotary year, we decided that it was very important that we touch on this very important subject, because we know that mostly, even though some men are also sometimes can also become breast cancer victims, but it's mainly women. And we know what happens when a woman passes, and then the effects of it. So because of that, we decided that at least it's an opportunity for us to reach out there to the community and basically do awareness to let them know, because as the saying goes, if you know, then prevention is always better than cure. Right. So that is the reason why we are undertaking this project.
Right. So why did you choose the Domi Enclave in particular out of the numerous suburbs and areas in Accra? Okay.
So we have actually been doing our projects across Ghana. In fact, we have done projects in the north, we have done projects in Greater Accra, even though we are based in Accra. And then, like you said, Rotary Club of Accra that is basically our catchment area.
Right.
But we realized that the Domain Enclave, we are doing it around the market area. We know there are a lot of women there. Right. There are a lot of our target group there. So it's going to be easy because of COVID-19. It's difficult sometimes for you to attract people to come. So we decided to identify a spot where it would be easy for us to attract people for them to come. Yes.
Okay, we'll get into the details of that project very soon. But let me find out from you, Rita, breast cancer. There's been a lot of conversation about it in the course of this very month and all of that. But this is what I feel, and it's my personal observation. It appears that every year after October, nobody's talking about breast cancer again. After this month, after the exercise is over, what else are you looking at so that the awareness is sustained?
Okay, thank you. In fact, we don't just keep quiet at the end of October, but it's a routine thing done at Kolebu and even for Run for a Cure. It's like they always go out there.
So Run for Cure, for the avoidance of doubt, Run for Cure Ghana is partnering with Rotary, right?
Yes. So we normally go out there to screen and then even treat, because we follow up on the cases until we get solution. However, even at Kolebu, where I work, we don't just end it there in October, but we have daily routine, and then we even have what we call a walking clinic. That people are supposed to come in at any time for their complaint. Kolebu is normally a referral point, where you need to get a referral before you come.
Right.
But for the purpose of breast cancer, we want people to feel free and come there. So at radiotherapy, there is this Tuesday walking clinic that any woman can walk in.
At Kolebu?
Yes, please.
And it's absolutely free?
Not free.
Right.
but at least it's accessible. One of the ways that we are trying to help in the advocacy role that we have to play. And so that is basically what it is. And we still go places whenever, wherever, to also give the necessary education on that.
Right. As a health practitioner, definitely you would be familiar with many of the causes that trigger breast cancer in the very first place. Here in this very studio, we've been told by a lot of experts that sometimes it's genetic compositions, lifestyle, and all. But in Ghana in particular, from your perspective, what really causes breast cancer in Ghana? The records that we have so far, what do you think is the triggering factor here in Ghana?
In Ghana here, I'm still seeing the trend in the genetic factor and then the lifestyle. Seriously, it's
what particular? I want you to be specific about lifestyle. What really do Ghanaian women do that predispose them to the infections?
All right. I wouldn't be able to point out any particular thing, however, but all I'm trying to say is that at the end of it all, you realize that even if you don't have a particular lifestyle that can predispose you to getting this breast cancer, what happens is that we don't take care of our own bodies. We don't know our own bodies. As in our breasts, we as women, we don't know our breasts. Because there have been instances where there is this woman who came to the hospital. She was, she felt the lump. She came, they had the examination done, and then they told her there's nothing there. She said she insisted on a biopsy. They tried it. They took it, confirmed that there is nothing. She said, no, I know myself. I know my breast. So when she did a follow-up on the investigation, it came out that indeed she had breast cancer. And it has been cured. So it tells us that one of the main factors as far as lifestyle is concerned, is the fact that we do not even examine our breasts. We don't know our breasts well, such that when there is any change in it, we will be able to detect it quickly and then find solution to that.
So self-examination is critical then?
Very critical.
What is the simplest means of examining yourself?
Simplest?
Yes.
Simplest is to find a comfortable place that you can expose your breast. And then if you are menstruating, the comfortable time is 5 to 7 days after your menses, because of how tender our breast becomes when we are menstruating. And then if you are not menstruating, you find a particular date that you can't forget. For instance, I'm a 15th born of a man. So maybe 15th, I wouldn't forget it. So I always use every 15th of every month to examine my breast. And we can do that standing, sitting, or lying. But if you're a beginner, you don't know much about it, it's better you lie. And before then, you ought to stand in front of the mirror and really look at your breast. And some of the signs and symptoms that you ought to look at are the change in the symmetry, the size of the breast. Automatically, one is bigger than the other. However, when there is
naturally one is bigger than the other?
Yes, please, naturally.
Wow.
However, when there is a problem, the smaller one can be relatively small. And even the bigger one can also be extraordinarily
bigger.
Yes, please.
Okay.
So also we look at maybe the color change, but as a dark person, you wouldn't see any color change. But you could see the rashes, the scaliness, the dimpling of the breast, which is like orange-like pale. You see a good orange. When you look at the pale, there's some dimples.
When you say dimpling of the breast, I mean, for those who are watching who may not understand the term, what exactly do you mean?
I mean, if you take a look at orange peel, there are dimples on it, like small holes. Right. And so when there is any such cancerous cell in your breast, what it does is that it tries to pull the skin inwards, and that creates the dimple. And so you will see it like under normal circumstances, my skin is just like this. But when there is such a problem, you see that it starts going in little by little, as though you know what a dimple is. Right. So those simple depressions you see.
It's well understood. Mr. Haruna, so of course, with all of this dynamics, the exercise is definitely a commendable one. So what are the details? At what time is it starting? And which people are you expecting to gather come this very Saturday?
Okay. So our main target women. Sorry, and I did indicate that you know, we are doing this around the marketplace. So we basically inform the queen mothers, we have informed the assemblymen, we have informed the community leaders, because we have to create the awareness that an event will take place. Otherwise, you go there, you come here and sit in TV Africa and make all sort of, you know, but if the people don't come there, you will not be able to meet your target.
So the announcement has been extensive enough, I believe.
Very extensive.
Right.
And then, so I'm appealing to viewers that it's going to be this coming Saturday. It's free. There's going to be awareness, the first part, and there's going to be screening. And we are starting at 9 a.m. and we'll finish at 4 p.m. In fact, our target is to do at least 200 women.
Right.
So our target is mainly women. That is our target number of the people that we want to attend to is 200. So there will be awareness creation and then the screening. With
what is the difference, if I may ask, the awareness creation and then the screening?
Okay, so the awareness creation is what we are doing right now. Like
Okay.
you were, Rita was basically telling us what to do, the signs, the symptoms, and then self-examination and all those. That is basically the awareness creation.
Right.
So the awareness creation is not only at the event center. What we are doing here is part of it. In terms of even Rotary, what we have done is that for this month, every day we send out a flyer giving information. What is breast cancer, what are the symptoms and all those things. We are creating the awareness. Then the screening is mainly where you do this examination. So we'll have health experts who will be there, who will do the examination for you. So those people who are not able to do it by themselves, because Rita did mention that a self-examination is part of it. So if you don't know how to do it, you come there, you'll be taken through the process, and then from there, every month, because it is advisable that every month you examine your breast. So that is basically the difference between the awareness creation and then the screening itself.
Right, our time is up, but I want to find out from you, in the course of the examination, if you are to detect that somebody is showing signs of having, you know, the issue, what are you going to do? Apart from the examination, are you going to extend any further help apart from just, you know, diagnosing?
In fact, that is something that we can take further. Like I said, for now, our focus is the screening and the awareness
creation.
Where there are referrals, at least we can liaise with our partner, Run for Cure Africa, Ghana, so that we can take it further.
Right.
But I wouldn't sit here and promise. But we are a voluntary or a charity organization. If my club is not able to take it further, there might be a club somewhere that will say, okay, once you have done and identified these people,
we'll continue from there. Right.
Yeah.
Thank you. Your very final words to women who are watching you. Of course, I'm expecting that the exercise will be massive and then the patronage would be boosted. But your final words to women who are watching, what are they supposed to do by way of lifestyle, by way of, you know, taking care of themselves and the whole prevention dynamics?
All right, thank you. I am of the view that as women know the color of the facial powder they use, they should know their breasts same way, such that if adventure there is a picture of only breast on a wall, a woman should be able to say that this is my breast.
My breast.
That is all I can say for now.
All right. Thank you very much. Your very final words, and then we are out.
And making an appeal, that is the most important thing, is that we have a target number of people that we want to attend to on this coming Saturday. It's going to be at Domi Park. We are calling on, if you live even far away from Domi and you cannot afford it, I think you can afford a trotro.
So people around this very suburb, TV Africa, North, if they can hear you and they come, you will still go ahead and...
Sure, anybody. Right. There's not going to be discrimination in terms of whether you are a resident in Domi or not. Once you come in, you join the queue, and we make sure that all the COVID protocol is taken care of.
Right.
And then once you come in, definitely we'll attend to you. But before I end, I also want to take this opportunity to thank Run for Cure Ghana, because we are partnering with them. And they have been in the business for a while now, because there's an umbrella, Run for Cure Africa, and we have Run for Cure Ghana. And usually every year they do a 5-kilometer walk where they mobilize resources. In fact, they have actually bought 2 mammogram machines for some hospitals, and they continue to do that. This year,
doing well.
They couldn't do it this year. But so I make a direct appeal to all people living within the Domi area that this Saturday, come out in your numbers. We'll be there to give us free breast cancer awareness and screening.
Right. Mr. Mumuni Haruna, we are extremely grateful for coming. Thank you very much for your time.
Thank you very much.
Great. And Madam Rita Odonko, we are also grateful. Highly appreciative. Okay. So this morning I've been speaking to Mr. Mumuni Haruna. He is the president of the Rotary Club Accra East. And then Madam Rita Odonko, she is a senior health tutor at the Public Health Nursing Training School, and also she's part of Run for Cure Ghana. They have been in the business of, health advocacy for a long time, and the two, organizations are partnering. So if you are in Domi or you are watching from everywhere, this Saturday, get to the Domi Park, be screened, and then you may find out that possibly you have an infection. If you do not, I'm sure that pieces of advice will be extended to you. We are continuing with the show, but we're taking a breather.